you know, being realistic, we now hear the state's running another deficit. There's already a governor's proposal for cuts. But we have to keep this, we have to keep pushing this issue, because someday we will, it may be this session, may not be, but someday we will achieve Medicaid funding. And if you're a provider, or you know somebody who's a provider, ask them whether Medicaid funding for interpreter services would make a difference. And every single one of them will tell you that it will. It just will. It's a huge expense. They're reluctant to do it. They're obligated to do it by law, but they're reluctant to do it. The third piece is possibly enforcement actions with respect to providers who are not meeting the federal requirements. The partnership isn't going to engage in enforcement, but some of you, maybe most of you know I'm a lawyer, so I just can't resist that as an option. And so I actually have gotten my law firm to agree that we can begin to do that kind of work should we encounter those sorts of situations. And the last piece is to try to get somewhere in state government, be it DPH or DSS or someplace, first a law and then, or a regulation that actually defines what the qualifications are for a medical interpreter that have to be met. Because, you know, currently when people are lucky enough to get an interpreter, the quality of the interpretation often, not always, but the quality of the interpretation can often be subpar. And so to have clear state standards and a certification process for interpreters is something important with respect to ensuring interpreter services. So those are the main prongs of our language initiative. But that's not the only thing that we resolved to do. We also began to have a discussion, and I think it arose in some manner